My grandmother always been my inspiration. She once told me, don't take from your community. Give back to your community. And once you do that, you will see and watch it grow. My name is Monisha Gutierrez, and I am a community health worker. Being a community health worker and working in my community, it trained me to be who I am today. Growing up poor in South Central LA, you can choose to go in one direction, gang banging. That's the only way you know how to make money if you don't have an education or a job. I knew that I wanted to become something great or a role model or be a mentor to someone, but I was broke. I was living off my grandmother, interacting with certain people in the community that I knew that can get fast money. So it was just one day in the community trying to make things happen for myself, but I got shot with a shotgun. It was a young lady, gain initiation. She had to either shoot or kill someone, and I was just that person at that time. The BBs went into me, into my thigh area, and then in my back. The doctor told me, oh, you won't walk anymore. You won't be able to walk anymore. And I was upset when he told me that because I felt like he just counted me out. Like, no way, no shape, no form. He's like, no. I told myself I could live this life and just be a victim of my environment, or I can get up and change something. I have a son, so who's gonna be the role model for him, or who's gonna motivate him when something goes wrong in his life? So I got up. I started doing PT. I started off by crawling. I started off by using my right side a little bit more than my left side. And I started moving my leg, even though my mind was like, it doesn't work anymore. So what? I'm moving it. What got me back to walking was honestly my determination and just being driven. So I started getting my act together, changed my surroundings as far as who I was once associating with. A close friend of mine looking for jobs in a resource center. She stumbled across community health worker. She called me and said, this job is for you. So I applied. I got a call back. What do you know about diabetes? What do you know about arthritis? I said, I don't really know too much, but I know how to work inside my community. I know how to work for my community. So if that helps any, sure, that helps. I said, okay. And I'm here today. Regina was raised in this community. She was one of my first patients when I hit the ground as a CHW. She was referred by her doctor. She was missing her appointments.
I was in a homeless shelter when we met, and things were so bad.
She was depressed, and she felt like the system had failed her numerous times. And I explained to her that you get a new day every day to start all over again. She's placed in housing, she's picking out furniture, so I'm happy with that. And she's happy. I run into my peers in the clinic. Just knowing that I'm here in my community and I'm actually giving back, they feel comfortable enough to come to Hubert Humphrey. They know, oh, okay, Monisha's there, so she will help me. Some patients just need a little bit of a push. Some patients might need someone to just support them.
Lost 30 pounds, yes.
Congratulations. My past has helped my present, and I know it's definitely gonna put an imprint on my future. I wear heels every day, honestly, because it's a constant reminder that I have to keep stepping, keep moving forward, and it builds my calves. I've learned so much in my training programs with social workers and doctors. They inspire me to just move forward with my life. Never in a million years did I think that I would be doing what I'm doing today. I love my job, honestly, I do.